Hello. So today we'd like to take some time to focus on cystic fibrosis. So on West 7, we specialize in several different respiratory diseases, one of which being cystic fibrosis or CF. Cystic fibrosis is one disease that some people do not know a lot about, so I'd just like to take some time to give a brief overview of cystic fibrosis to help give better care to this patient population. So, what is cystic fibrosis? Cystic fibrosis is an inherited disease that affects the lungs and digestive system. The body produces thick and sticky mucus that can clog the lungs and obstruct the pancreas. Cystic fibrosis is one of the most common deadly inherited diseases. It is a genetic disease. Worldwide, about 70,000 people have CF. Out of those people, every year, only about 150 to 200 CF patients receive a lung transplant. So of those 50% who do receive a lung transplant, only about 50% of them will live for another 5 years. So let's take some time to dive into some of the treatment options to help our CF population. So first, we have airway clearance. People with CF need to perform what's called airway clearance or chest PT. This can be done a couple of different ways. It could be done manually by means of cupping. So during cupping, the respiratory therapist will focus on an area of the lung that has the most phlegm or just sounds kind of junky. And this can be done manually with either a hand. Sometimes they'll use some sort of mask. Then they also can do what's called vesting. So during vesting, patients wear a vest that vibrates that helps patients produce sputum. This is often done multiple times a day, both at the hospital and while they're at home. When they're at the hospital, it is our unit's respiratory therapist that will do the airway clearance for us. So second, nutrition is an important aspect of care for the CF population. So our CFers will often receive double portions at meals, as well as extra snacks from dietary as well. We do need an order for this, so if you ever find yourself in the situation, you can just page whoever's covering and ask them for double portions or snacks. So the snacks can be found in our patient refrigerator in the kitchen. Additionally, the CF Foundation was generous enough to provide us with 4 mini fridges. On admission, CF patients should receive a fridge in their room. Please note that per our policies for our unit, the temperature of the fridge must be checked at least 24 hours. And there is a sheet up by the front desk that someone can show you where that is. That should be with the fridge too. Furthermore, many of our CFers have PEG tubes or Mickey buttons. These are used to help supplement nutrition in addition to eating. Additionally, our CFers also take some sort of pancreatic enzyme, whether it's Creon or Zenpap. There's several different types, with meals and snacks just to help with digesting food. Additionally, many CFers have what we call stenuria or fatty stools. This is normal for this population, so there's no reason to be alarmed by it. Also, so CFers use nebulizers and inhalers to help thin the mucus. They do this both at home and in the hospital. So as with airway clearance or chest PT, this is the responsibility of the respiratory therapist on our unit. It is important, however, that we communicate with the respiratory therapist because often CFers will request pain medications prior to their nebulizer and airway clearance treatments, as it can be kind of painful for them. Furthermore, CFers also take antibiotics and often steroids at home. During their exacerbations or tune-ups while they're at the hospital, patients will often be on 3 to 4 IV antibiotics during their stay. So this means that all CFers will have some sort of central access during their hospital visit. So many of our CFers have IVADs that will access on admission. Per our policy, the needle needs to be changed every 7 days. And some patients will get a PICC line placed at the beginning of their admission, which the dressing for that also needs to be changed every 7 days per our policy. So I would just like to take a couple of minutes to clear up a misconception. Many people think that if you get a double lung transplant that cures CF. It unfortunately does not. Patients who receive a lung transplant still have CF. So now I'd like to go over some resources that we have on our floor. So Monday through Friday from 8 to 4:30, there's the Complex Care Center NP that is in-house to help with orders and concerns. Additionally, an attending from the Complex Care Center will see patients who are from the Complex Care Center every day when they're inpatient. This is helpful because the providers also know the patients from outside of the hospital, so they know their care very well, and they usually have a personal connection with the patients. Additionally, the people from the Complex Care Center are very good about touching base to round with the patient's nurse each shift. So there's definitely a good open line of communication. Additionally, the Complex Care Center also gave us an exercise bike and Wii Fits that we can give to patients to help facilitate exercise while they're still in the hospital. So also, as always, we can also be using PolicyStat if you ever have any questions. Also, you should feel free to reach out to your unit Complex Care Center champions. There's several of us on the floor. Additionally, charge nurse is always a good resource if you ever have any questions on any of these patients. So I hope that you also remember that patients with CF also have chronic pain. So it's important that we as nurses are supporting them and helping to manage their pain and other symptoms however possible. I hope you found this overview helpful. Please let me know if you have any questions. Thanks.